Imagine peeling back thousands of years, yeah. And you find this text from ancient India, and it describes detailed surgery, fetal development, month by month, even tells you what not to eat at night. Just think, what could we learn about how people understood the body, illness, healing, long before modern science as we know it?
That's exactly the journey we're on today. This deep dive pulls from excerpts of the Sushruta Samhita, which is, well, a cornerstone classical Sanskrit text. It's often presented as really foundational work on ancient Indian medicine and surgery.
Right. And our sources kind of frame it as a science of life, where medicine sort of grew from. But interestingly, the preface, we looked at notes, it's faced some scrutiny, yeah. Especially from people who might see it as just empirical and maybe lacking what we call scientific anatomy or physiology today.
And that critique is part of why translations, like the English one we're using, are so important, really. The motivation, according to the source, is to share these ancient truths, these insights, beyond just, a small group. It's about opening up this knowledge.
Okay, let's dive in then. Our mission with these sources is to unpack them, find those really important, maybe surprising nuggets, and see what they reveal about ancient Indian understanding of health and healing. So what's the core of this science of life?
Well, it starts quite philosophically, actually. The text gets into the nature of ayus, which basically means life. It's described as a motion of something called an ethereal fluid, I guess.
An ethereal fluid. That feels very different from just a purely physical description of life. What does that suggest about how they saw vitality?
It implies a much broader understanding, I think. Ayurveda is seen as the sum of biological and abiological energies. So life isn't just the physical stuff, the processes we see, but this underlying moving energy principle that kind of animates everything.
And they connect this to a concept of the great self, almost like consciousness residing in the protoplasm.
Exactly. And the text makes a fascinating point here. It says that to really understand the work of this self, you don't just use the physical eye, you also need the mind's eye.
The mind's eye.
Yeah, it's about integrating direct observation with, well, a deeper kind of perception or contemplation.
So understanding the physical body is fundamentally tied to these philosophical, maybe even metaphysical ideas.
Absolutely. The source explicitly mentions connections to Samkhya and other philosophical systems. It brings in concepts like Prakriti, primal nature, Purusha, the conscious subject, Manas, the mind, and the 5 primary elements of creation. You see, the body, illness, healing. It's all viewed within this larger cosmic and philosophical framework where these elements and principles interact.
Okay, that foundation, that idea of life, energy, and consciousness really sets the stage. How do they then turn this lens towards the physical body itself?
Well, maybe surprisingly, there's a strong emphasis on anatomy. The text actually highlights how crucial anatomical study is, including dissection, specifically for developing surgical skills.
Dissection in ancient India. Wow. That feels like a very practical, hands-on approach.
It is, and the source really stresses that this direct observation through dissection isn't meant to replace studying the texts, the Shastras, but to work alongside them. You need both. And yeah, they even provide criteria for choosing a body for dissection.
Criteria, like what?
Specific things, like it shouldn't be too old, not someone who died from a prolonged disease or poison, and maybe a sign of practicality and hygiene. The excreta should be removed first.
Okay.
These details, they paint a picture of a structured approach to learning anatomy. Very different from today, obviously, but structured.
Right. So once they had these ways of observing the physical structure, how did they think about the body's internal architecture, the functions?
They described kalas, which we often understand as tissues or layers. For instance, the Raktatara kala is the layer containing blood found in veins, the liver, the spleen.
And one concept that might strike a modern listener is the Shukradhara kala,
right,
related to semen.
Yes, that one's quite different. The text describes this semen-bearing tissue as being present throughout the entire body of living creatures.
Wait, throughout the whole body? That's definitely not our current biological model. How did they explain that?
The source uses analogies, which really help clarify their view. Semen, they say, is like the fat present throughout milk, or like sugar throughout sugarcane juice. It's everywhere in potential, you see. But then expressed or concentrated in specific ways and places, it's just a different way of conceptualizing a fundamental substance.
Okay, that analogy does make the concept click a bit more. What about the network of vessels, veins, arteries, channels?
They talk about serous veins, Dhamanis arteries, and Srotas channels. And interestingly, the text mentions that some authorities didn't really believe in making arbitrary distinctions between these.
Oh.
Yeah, suggesting they perhaps saw them more as part of one interconnected network. A specific detail they mention is the origin of 24 Damanis from the navel region.
1-4 from the navel. Fascinating detail. And they got quite specific about what happens if you injure these channels.
Absolutely. For the semen-carrying srotas, which they said were rooted in the breasts and testes, injury could lead to loss of manhood, or delayed emission, or semen streaked with blood. And the artava, that's menstrual fluid-carrying srotas, originated in the uterus and damanis. So it shows they linked specific pathways to functions and understood the impact of damage.
Moving from structure to development, the text actually lays out fetal growth month by month.
It does. It lays out a timeline. Up to 4 months, it's in a liquid state, and expulsion is considered abortion. Limbs gain firmness in month 5 and 6. Expulsion then is miscarriage. The mind enters in the 5th month, cognition in the 6th, and limbs are fully formed by the 7th. And the ojodhatu, this concept of vitality or essence, is located in the heart at this stage.
And they divided up the parental contributions.
Yes, quite distinctly. Paternal contributions are things like hair, bones, nails, teeth, veins, nerves, arteries, semen, basically all the hard substances. Maternal contributions are flesh, blood, fat, marrow, heart, umbilicus, liver, spleen, intestines, bladder, anus, the soft organs.
That's a very clear division. And there's that more poetic idea embedded in there, too, about the mother and child's connection.
There is, yeah. The text includes the idea that the child in the womb feels pain when the mother does, whether that's from an injury or some internal imbalance. It really reflects a view of them as deeply intertwined.
From development, let's talk about those crucial areas, the marmas.
Ah, the marmas, yes.
Yeah.
These are described as vital points, specific spots where muscle, vein, ligament, bone, or bone joints meet. And they're considered seats of life, of prana.
Seats of life. So like particularly vulnerable spot.
Precisely. The text lists 107 total marmas, and they're classified by the type of tissue involved. A specific example given is the Kushiprā marma, found at certain points. Piercing this point, they warned, could cause death either right away or later on.
Wow.
It really highlights their understanding of critical points in the body where different systems converge and where life force is, well, concentrated.
Shifting gears a bit. How did they understand individual differences? They had the concept of prakriti, didn't they?
Yes, prakriti is absolutely fundamental. It's your inherent individual constitution. It's determined by which doshas vayu, pitam, and kapam are dominant at the moment of your conception. It's like your basic blueprint.
And the text gives distinct characteristics for each type. Some of them are, well, quite unexpected.
Oh, they paint very detailed pictures. Someone predominantly Vataja is described as wakeful, dislikes cold, maybe physically unshapely. And interestingly, traits like being thievish, vain, or dishonest are listed, alongside things like a fondness for music and physical signs like fissured hands and feet or rough hair.
Dishonesty linked to a physical constitution. That's a fascinating blend. What about Pitasha types?
Pitasha individuals are seen as courageous, having a strong memory, but also, hot-tempered, prone to anger. Physical traits include fair skin, maybe freckles, yellow bodily excretions, and a preference for coolness.
In Kaphaja?
Kaphaja types are generally portrayed quite positively. Pleasant, forgiving, strong, slow, stable, often wealthy. They tend to have oily, fair skin, and white bodily excretions.
It's really remarkable how these categories mix physical appearance, temperament, even things like wealth.
It's a very holistic view of the person, isn't it? Where your internal balance or imbalance influences everything. The text also briefly touches on mental temperaments. Sattvika, linked to purity, belief in God. Rajasika, irritability, shamelessness. And Tamasika, perverseness, maybe being stingy.
Thinking about these ancient categories, inherited constitution, how might this resonate, or maybe sharply differ, from our modern ideas? Things like genetic predispositions or personality types.
That's a great connection to make. While modern science focuses on DNA, neurochemistry, this system is centered on the balance of these vital energies or humors established right at your origin. The framework is different, definitely, but the core idea that our fundamental makeup influences our health and personality. That's a shared thread, a shared idea across millennia. It's a different lens, but pointing at a similar phenomenon, maybe.
So what happens when this carefully balanced system goes wrong? How do they diagnose and understand disease? What do they see as the causes?
Well, the text points to numerous causes of illness, and many are linked to lifestyle and diet. Things like incompatible food combinations or eating before your last meal has digested, excessive sexual activity, sitting for too long in certain postures, too much riding, even voluntarily suppressing natural bodily urges like needing to sneeze or use the restroom.
Those causes, some of them sound surprisingly contemporary, maybe framed differently, but the basic idea that your choices impact your health, that's still fundamental, isn't it?
Absolutely. And the text goes into really great detail describing how a dosha imbalance actually manifests. For example, deranged vayu is linked to a huge range of symptoms, from numbness and convulsions to anesthesia and pain.
They even had specific names and descriptions for some pretty dramatic conditions caused by these imbalances.
Oh yes, like Antaryatma Dhanushtamba. This is where deranged vayu supposedly causes the body to bend forward like a bow, with fixed eyes and a paralyzed jaw. The descriptions are incredibly vivid.
And the sources list a really wide range of specific diseases they identified and classified.
They do. They have detailed sections on many conditions. For mouth diseases, Mukaroga, they describe various issues, including something called dantanadi, which sounds an awful lot like a sinus tract coming from a tooth root infection. Skin affections, kushta, are classified into major and minor types with specific names like kapala, udumbara, and visarpa.
Tell me more about Visarpa. The description in the sources sounds pretty severe.
It does, yeah. It's described as being like erysipelas, spreading rapidly with burning, pus formation, and potentially leading to loss of consciousness or even epileptic fits. They even distinguish specific incurable types, like pundarika and kakanam, linking them to congenital issues or the involvement of all three doshas.
They also seem to have had a pretty sophisticated understanding of urinary issues, Prameha.
Very much so. The text uses the appearance of the urine itself to distinguish different types, watery and painless, or like sugarcane juice, wine-colored, having sand-like sediment with pain, or slimy mucus passed in jets. This shows real empirical observation.
And the list of associated symptoms is quite remarkable, too.
It includes fascinating details, like the urine attracting swarms of flies, symptoms like lassitude and obesity, and a description of actually analyzing the urine based on its taste. They mention alkaline taste, its smell, color, and touch. This is effectively ancient urine analysis.
Wow. What about abdominal problems?
They describe different kinds of abdominal enlargements, udara. Vata gudararam, for example, is described as dropsy with rectal constriction, difficult stools, and, quite strikingly, fecal vomiting.
Fecal vomiting. That's a very grim but clinically sharp detail from the text.
It really highlights the level of detail in their clinical descriptions. Parasrava udaram involved fluid accumulation, described as water percolation. Abscesses vidrati are also covered, with certain locations near the heart, bladder, umbilicus, or types like those involving all three doshas or the marrow, considered incurable.
And swellings or tumors.
Yes, granthi, which are like glandular swellings, and arvudam, tumors. They're described as naughty, elevated swellings caused by deranged doshas, with characteristics varying depending on which dosha is dominant. And again, certain locations like a Sushruta channel, an artery, or a vulnerable joint would render a tumor incurable in their system.
The text also lists many minor diseases, Kshudraroga, but some of the descriptions sound, well, anything but minor.
That's true. Yavapraksha are described as hard, knotty lumps like barley corns. Agni Rahini is a fiery swelling noted as being fatal within 7 to 15 days. There's perivartika or phimosis, and galacindite, a description of tonsillitis that likens it to an inflated skin bladder.
Inflated skin bladder for tonsillitis. It gives you such a vivid visual sense of what they were observing.
Exactly. It makes the ancient description feel tangible. Diseases of new mothers, sutika rogas, are also covered. They're linked to lifestyle choices after delivery and often given a poor prognosis, especially if caused by, say, fasting or not getting enough nutrition.
And ulcers, conditions like gout, described with similar detail.
Yes. Ulcers, vrana, have general symptoms like pain, but specific qualities tied to the dosha involved. So, vataja is dry, heavy, slimy. Pittaja is hot, burning. Raktaja is described as looking like red coral and smelling like alkali. Vatarakta, which sounds a lot like gout or rheumatism, is described with symptoms like throbbing, burning, swelling, numbness, weakness, and colored patches on the hands and feet. The consistency in describing symptoms based on that underlying imbalance is really a key feature throughout.
So they had this incredibly detailed system for understanding the body and disease. What about the treatments, the procedures they used?
Well, the text outlines a really broad spectrum of therapies. This includes actual surgical operations, shastrakarma, bloodletting or venesection, cauterization using fire or alkali, various external things like plasters, fomentation or sveda, anointing, abhyanga, poulticing, upanda, immersion baths, evacuation procedures they called visrava, massage, and bandaging, bantana.
Let's focus on some of the more specific or maybe surprising procedures. What about venesection, the bloodletting?
Okay, so they specify locations for opening veins, like 4 fingers below the navel for ascites or between the breast and armpit for certain internal issues. But there's a really striking caution included.
A caution about bloodletting.
Yes, the source contains this memorable verse warning that just having practical experience isn't enough for venesection because veins are, and this is the quote, naturally unsteady and changing like fishes.
Unsteady like fishes.
Wow. It really underscores the difficulty they perceived and the potential dangers. It notes severe consequences, even death. If a vein in a marma, one of those vital points, is injured, they called it marma vidhai.
That's such a vivid way to describe the challenge.
Yeah.
What about internal treatments like enemas?
Vasti, or enema, is considered a major treatment. The text describes different types, Estapana, Indivasana, Uttarabasti, and the level of detail on the actual apparatus is quite specific.
Apparatus details from thousands of years ago.
Yes. It describes the specific lengths and diameters for the pipes based on the patient's age and the amount of fluid needed, and it's measured using the patient's own fingers. It even mentions cornicas, which are like flanges on the pipe to stop it going in too far. The quantity of fluid itself is measured by presrita, which is basically what fits in the hollow of the patient's own palm.
Measuring with the patient's own body parts. That's such a unique detail. It really suggests a tailored, individualized approach to delivering the treatment.
It really does. And the text describes the application process and claims pretty significant cumulative effects for repeated sneha vastas. Those are oil-based enemas. It says they permeate the pelvic region, restore vitality, improve strength and complexion, and penetrate tissues like rasa and blood. It lists a huge range of conditions. A specific vasti is supposed to cure abdominal problems, urinary issues, skin diseases, even things like insanity. And crucially, it tells practitioners to adjust the vasti based on the season, the patient's strength, the disease, the doshas involved, and the potency of the ingredients.
And they also use treatments applied through the nose. Nasa.
That's right, nausea or nasal administration. It's divided into 2 main types, sirovirachana, which are air rinds meant to clear mucus, and snahana, which are oily types. It's primarily used for conditions above the clavicle, especially those involving kapha buildup in the head, or vayu and pitta imbalances in that region.
Did they have specific timing rules for giving this?
Yes, they did. Generally before meals, but specifically in the morning for kapha conditions, noon for pitta, and evening for vata. And for one specific type, Pratamarsha snuff, the benefits are linked to when you use it. So after waking up, it clears nasal mucus and cheers the mind. After cleaning your teeth, it gives a sweet aroma and firms the teeth. It also lists contraindications, things like indigestion or sleeping during the day.
Going back to surgery for a moment, beyond the dissection we talked about, what other surgical details stand out?
Well, the text discusses wound suturing and plastering, and techniques for cosmetically changing the color of scars, the cicatrix, like blackening them with oil and ashes or whitening them with certain pastes. For amputated limbs, the instruction is to wash the stump and then cauterize it with oil or fire.
Cauterization after amputation. Sounds incredibly painful, but probably a crucial step for preventing infection back then.
Absolutely, almost certainly. For urinary stones, the section on lithotomy, that's stone removal surgery, includes a very detailed and stark warning about the risks of injuring the structures around the bladder. It explicitly states that damaging the urine channels can lead to death, and injuring the semen ducts can cause death or loss of manhood.
That warning. It speaks volumes about the dangers and potential complications they were clearly aware of during such an invasive procedure.
It really shows a clear understanding of how critical those specific structures are. Post-lithotomy care included things like sitting in warm water and injecting a decoction into the bladder if blood accumulated. For fistulas and sinuses, the Kashara Sutra technique is mentioned, along with specific incision shapes like Langalaka.
Kashara Sutra.
Oh.
That's fascinating because it's an ancient method that actually still sees some use or study today, particularly for fistulas.
It is one of those techniques that has endured, yes. The text also notes using specific preparations, like karanja oil boiled with cow's urine, for chronic conditions like fistulas and malignant ulcers.
Cow's urine and oil as a treatment definitely reflects the kind of materia medica they had available. And there was that one absolutely wild detail about intestinal surgery.
Yes, that one. For a type of abdominal enlargement, udara, that involved an obstruction, after removing the blockage and purifying the intestine, the text describes using, get this, large black ants to hold the severed ends of the intestine together.
Hold on. Large black ants, used like sutures. That detail is absolutely astonishing. I mean, I've heard of ants being used maybe to clamp small skin wounds, but for severed intestines, what does that specific technique reveal about their ingenuity, or maybe just the sheer challenges they faced in surgery?
Well, it points to both, I think. Desperation, maybe, but also incredibly creative observation. Without modern sutures, they seem to have looked around and utilized available biological tools. The ants' mandibles would clamp the tissue shut, right? And then, presumably, they'd remove the ants' bodies, leaving the jaws gripping the tissue edges together long enough for healing to start. It's a vivid, almost jarring example of their practical approach, given the constraints they were under.
That's a detail that really makes the past feel both incredibly distant and yet strangely resourceful. What about dealing with poisoning? How do they handle that?
They had methods for detecting poisoned food or drink, often using animal and bird reactions as sort of early warning systems. The text lists specific reactions. Cats getting catarrh, a cuckoo's call becoming hoarse, a monkey passing stools, a peacock suddenly becoming sprightly or agitated, various birds screaming or changing their calls, even a spotted deer shedding tears.
That's like an ancient organic toxicology panel, using the natural world around them to detect danger.
It really is. For treatment, the methods included using mantras and ligatures, sucking the poison blood out after preparing the mouth, sometimes with substances like burnt earth or ash, using emetics to induce vomiting, and administering special anti-venomous preparations called agadas.
And there's a key point about using these agadas, these antidotes.
A very important one, yes. The text emphasizes that any supervening symptoms of the poisoning things that might crop up alongside it, like fever, swelling, or epilepsy, those must be treated with their own specific remedies at the same time as the anti-poisonous medicine. And crucially, the text states agadas are only for poisoned cases. It explicitly warns that they actually cause discomfort in healthy people who aren't poisoned.
That distinction shows a really nuanced understanding, doesn't it? Recognizing that a potent therapy is meant for a specific condition and could actually be harmful otherwise.
It does. It suggests an awareness of side effects and definitely the importance of getting the diagnosis right in the first place.
Beyond just treating illness when it happened, the text also seems to focus quite a bit on maintaining health, enhancing life.
Yes, there's significant lifestyle advice woven throughout. For exercise, the rule is pretty clear. Only exercise to half your capacity. Going beyond that is considered potentially fatal, with the sign being pranavayu, the vital breath, coming out through the mouth, which sounds a lot like heavy mouth breathing signaling overexertion.
A simple, clear limit for exercise. What about dietary rules?
Well, rules include not eating before your previous meal is fully digested, avoiding eating too little or too much, and avoiding food that doesn't have some kind of oleaginous substance, some fat or oil. And there's a very specific absolute rule about curd or yogurt.
What's the rule about curd?
It should never be taken at night, and never without adding sugar or ghee.
Never curd at night. That's such a specific rule. Seems almost arbitrary from a modern view, but clearly very important in their system.
It's presented as a very firm rule, yes. Sexual conduct is also detailed, with rules about timing linked to the menstrual cycle if you wanted a child of a specific sex, avoiding certain partners, like those who are spiteful or sterile, avoiding certain locations like unclean or exposed places, and also considering your physical and mental state, avoid it when you're enfeebled, thirsty, standing up, or feeling cheerless.
And consequences for overindulgence are listed too.
Severe ones, actually, including phthisis, which is kind of wasting disease, spleen enlargement, epilepsy, and heart disease. So they directly linked sexual health to these broader systemic conditions.
They even have advice on childcare and assessing breast milk.
Yes. Criteria for pure, healthy breast milk are described. It should apparently have froths and shreds, and importantly, it should neither float nor sink when you place a drop in water. Milk from women who are hungry, tired, ill, or pregnant is considered unsuitable.
Neither floating nor sinking. Another simple, observable test for quality. And what about practices to actually enhance life itself?
Right. That's where Rasayana or rejuvenation and Vajikarana virilization come in. Rasayana aims for longevity, preventing decay. Methods include using specific herbs like Kadira decoction, which is mentioned for rapid recovery from chronic diseases like Kushta or dropsy.
And Shilajatu, that mineral pitch, features prominently.
It's highly valued, yes. The text describes where it comes from, metal essences seeping from rocks, its taste, and its properties, like being laxative, heat-making, absorbing. It even notes that its effectiveness for promoting long life, health, memory, and intellect increases depending on the metal it supposedly originates from, tin being less potent than lead, and lead less potent than iron.
So they had this concept of potency tied directly to the mineral source.
Exactly. Vajikarana, on the other hand, focuses specifically on sexual strength. It explicitly states its purpose is to make a man sexually strong as a horse, and it's noted as being particularly beneficial for, and this is quite specific, gay, handsome, opulent youths with many wives, indicating a particular audience for this practice.
A very specific demographic indeed. And the means included nutritious food, sweet drinks, specific remedies, and following the rules we mentioned. Wow. Okay, looking back over everything we've covered, just from these excerpts, it's incredible. From the fundamental philosophical grounding of life and consciousness, through incredibly detailed anatomy, fetal development, understanding critical vital points, classifying individual constitutions and temperaments, then this vast catalog of diseases with such vivid descriptions, outlining sophisticated surgical and medical treatments, including ancient diagnostics, toxicology, all the way to practical lifestyle advice, rejuvenation practices, even treatments for virility. I mean, it's just an astonishing breadth of knowledge packed in there.
It truly is. It's a powerful illustration of the depth of observation and conceptualization that was present in these ancient texts. And you see this clear blend, don't you? Empirical methods, dissection criteria, detailed clinical symptoms, the urine analysis, those animal reactions to poison alongside these really profound philosophical concepts like akasas, the self, the elements, and marmas as seats of prana.
And some of those details, like using ants for intestinal sutures, or that specific test for breast milk, they're just mind-bending from our perspective today. It really makes you appreciate the ingenuity and maybe the different ways humans have approached understanding their bodies and health, even without all the technologies we rely on now.
It certainly does. And it leaves you with a fascinating question to maybe ponder, doesn't it? What does this deep dive into just a part of the Sushruta Samhita tell us about the common threads and maybe the vast differences in how humans have perceived their physical selves and their well-being across millennia? You know, how much of this ancient wisdom, both the empirical stuff and the philosophical, how much of it resonates or maybe clashes with our understanding today?
Yeah. And what other secrets might these rich old texts still be holding, just waiting for us to uncover them? Maybe, like they said, with our mind's eye as well as our physical one, definitely something to think about.